Now, the lack of beds has forced doctors to treat patients in plastic chairs and on the floor. It follows a directive by the health minister for doctors not to refer cases for lack of beds. Pictures of the situation shared on social media have triggered an uproar. Officials at the hospital say the latest state of affairs predisposes patients to infections. My colleague Maxwell Agbagba was at the hospital and now reports.
The surgical and medical emergency units at the Korle-Bu Teaching Hospital is virtually bursting at the seams as lots of patients receive their intravenous fluids on plastic chairs. Some of them have no choice but to sit on kitchen stools to receive treatment. Here at the surgical emergency units of the hospital, I met one Fatih Janat. Her child was brought here to this facility with a cardiac arrest. Later in the evening of yesterday, she had no choice but to find solace on the hard concrete floor at the hospital.
Was in critical condition, cardiac problem, all the way from Kaswa in an ambulance. When we entered, in fact, there was no bed, but they didn't say so. They said they had been told not to reject anybody. So they admitted us, tried whatever to resuscitate her. But she was lying on the floor wailing. There was nothing they could do because there was no bed. I went home in the night around almost 12. My grandchild called me and said they've been asked, all of them have been asked to come and sleep outside because other patients were being brought and there was no place for anybody to sit. We were just hanging around her. He was lying, rolling herself. Girl called me and said they've been asked to sleep outside under a staircase. If I became too worried, somebody with a heart problem, if something happens in the night, the nurses are not around. So my grandchild worked all night while the girl was wailing. Today too, we came to see her sitting on a plastic chair. You see? You have seen her condition now. It's deteriorating. See, under here, have you seen those cars there? Yeah. They lie them under and they're sleeping. My sister stays near. You have to bring them a foam mattress yesterday in the night for them to sleep on.
I've been speaking to the public relations officer of the Korle-Bu Teaching Hospital, Mustafa Salifu. He says the directive that the hospital should treat all emergency cases has further aggravated the congestion situation here at the Korle-Bu Teaching Hospital. He says they have communicated to all sister clinics and hospitals not to make any referrals to this facility until they are able to deal with the congestion situation.
This is a 36-bed facility unit. But as of yesterday, the patients that we had were in excess of 60. So it means we have literally doubled the number of patients we actually have at the SME. So that was why we had patients on chairs and some of them were even outside. This morning there was one patient, but fortunately the person has been moving because I'm sure space has been created for the person to move. So that is the situation we find ourselves in. But the moment what we are going to do, we are linking up with other hospitals to inform them not to refer. They can do telephonic consultations to give them guide on how to deal with those except the dire emergencies that they will still speak to us and then we take them. We want to do this for 48 hours to allow the place to decongest so that we can start receiving. The spaces with the creators, they have all been moving now. But you still have patients sitting on chairs receiving treatment at the SME now, as I speak to you now. But in order to deal with this, there are certain measures that we have taken as a hospital. As we went, maybe we'll move there, we'll see the emergency that we'll be moving in before the end of this month. That will provide us an additional space. It will literally double the number of beds that we have here at the new place. We started planning for a bigger place almost 10 years ago. That is the Acute Pain Management Center. So that will substantially deal with the problems we are being confronted with at the moment.
Maxwell Agbagba speaking to the PRO of the Korle-Bu Teaching Hospital. So as the recurring discussions about Ghana's poor healthcare service, especially emergency care resurfaces, the Ghana Medical Association wants citizens to charge at the government for change. This conversation has been up before and has been given some assurances from government. Well, it doesn't appear to have changed or improved over the period. Let's have a conversation on Ghana's emergency health system. Joining us live from the Ashanti region is the emergency physician, Dr. Maxwell Osei Ampofo, who is also Deputy Coordinator of the National Ambulance Service. Sir, thank you so much for your time. Good afternoon. So it appears that we're dealing with a problem. We're creating a bigger problem, trying to solve...
Good afternoon. Thank you for having me.
Right. It appears that we are creating a bigger problem, trying to deal with an existing problem. Is there any hope at all that we can fix this?
Well, thank you very much for having me this afternoon. I think that it is never too late to do something good. We are currently in a crisis situation as far as emergency healthcare in Ghana is concerned. And I think that we can begin from somewhere. We need to plan, we need to prioritize. Once we start doing that, I think that we'll be able to bridge the gaps that we find now quite significantly in the next few years. What needs to happen for us to know that human lives matter, and that we are going to plan to make sure that we improve our emergency healthcare services, and that within some few years, we've tried to tackle all the aspects of emergency care, pre-hospital emergency care, in-hospital emergency care, communication systems, try improve infrastructure, the personnel and equipment. And if you try to do that from now, then I'm very hopeful that in the next few years, you'll not see the same scenarios, or you'll not be talking about the same situation going forward. But we need to start from somewhere, and it's not too late to start something good. And this is good to start thinking about how to improve the emergency healthcare of Ghanaians. So it's not late, we can start. I've always been given the analogy about the ambulances. You see, the ambulances, when we are talking about the pre-hospital emergency care system now, the emergency medical services. Now, ambulances have a lifespan. And this lifestyle, this standard set is actually, set from, the developed countries. And they set a standard of 5 years. After every 5 years, you need to replace your fleet. And considering the nature of our roads and the usage of our vehicles, we should rather even be thinking about less years of replacing our fleet. But it's about getting to 9 or 10 years now, we've not replaced them. If every year we know that in 5 years' time, all our fleet will be down, we're supposed to be changing them. Every year, we are replacing 2. Every year, we are replacing 5. By now, we'd have gotten, significant numbers in our system. I think that lack of planning and prioritizing also contributes significantly to where we are now.
You speak about, the ambulance service. At the moment, what we're dealing with is the congestion at the Korle-Bu Teaching Hospital. I mean, this is the nation's premier hospital. We're dealing with congestion there. Now, everybody seems to look up to Korle-Bu as the savior. If the savior is failing, who else can save? What would you recommend to be the next immediate practical step that health officials at Korle-Bu can take in dealing with the situation of congestion as we're seeing, as terrible as it looks? Health officials at Korle-Bu can take in dealing with the situation of congestion as we see, terrible as it looks.
Right. So, Matilda, is all part of the system. The outcome of a patient who is critically ill or injured depends on the interventions that are given to the sick or injured person in the pre-hospital setting, whether it's in the house, whether it's by the roadside, whether in the car, whether it's at the church place, whether it's at the gym, anywhere that you find yourself, there can be an emergency or there can be an injury, whether you're in a car. And the outcome, whether we have a good outcome for such a person, or whether we have a bad outcome, or there's a death or disability, it depends on the interventions that are given in the pre-hospital. That's why I keep on, emphasizing the pre-hospital setting. And then our primary healthcare system. Now, you know that a lot of people are presenting to the emergency departments with complications of already existing conditions that they never knew about. Now, if we have a very good pre-hospital system and then, a primary care system, then all these complications would have been dealt with before, or even the diseases would have been diagnosed. Let's say somebody with hypertension coming in with a stroke, somebody with diabetes coming with a diabetic ketoacidosis, coming with an infection. They are even coming here for the first time to the emergency department, and then they are now noticing that they have such a disease. So to talk about the congestion, we need to also address all those issues that confront us as far as personal emergency care is concerned, and then primary health care is concerned, so that, you know, screening and diagnosis of diseases will take place there, so that people don't present with emergencies. Now, you're talking about the congestion at the Korle-Bu, you know, surgical emerging medical unit there. You know that Korle-Bu is a major referral center in the Greater Accra region. And almost all referrals are going to them. I know that other places are also taking care of referrals. But what needs to happen is for us to have a system where patients are tried even before they get there, so that lower acuity, as in less severity of illness and injuries, are not taken to Korle-Bu, where it can be seen at other places, let's say at Lekma or at Police Hospital or at 37, so that the severity, those who are very severely ill or injured, will then be taken to Korle-Bu. So we have to have a track system, sorting out system, where, you know, patients are actually categorized that, okay, this illness or injury can be seen at this facility apart from Korle-Bu, so that we don't send every patient to, you know, Korle-Bu. And there should be a communication system amongst the hospitals. We have to know how many beds are available at Lekma, how many beds are available at Police Hospital, how many beds are available at 37 Military Hospital at every point in time, so that we know that, well, there are 3, you know, high acuity beds at Korle-Bu now. If they are intermediate or minor or moderate illness or injuries, they should be taken to, let's say, Police Hospital or 37. Then, until we're able to do that, all the patients will, you know, tend or gravitate towards Korle-Bu, and then, you know, they would have very difficult time trying to sort out these patients. The other thing is that, you know, this is in the short term, where we can now immediately set up, you know, a communication system where the hospitals can link up and know their bed state, emergency bed state, so that they can be attending to different categories of patients at the same time. But going long term, we have to try and make sure that we improve functional emergency departments and emergency rooms across the country. You know, a lot of buildings are being, you know, put up now, but these are structures, and whether they are fit for function is another, you know, question. We need to make sure that if you are putting up buildings, there are clearly defined emergency departments inside there. It's not that after it's been built, then they realize that it's an afterthought. We need an emergency room, so that even patient flow is difficult if you are using such a facility. We need to improve functional emergency departments, emergency rooms across the country, so that we will decrease, you know, the congestion at the places where, you know, we have emergency departments. Now, Korle-Bu is suffering because a lot of people are gravitating towards that. If they knew that, well, we could have similar or, you know, excellent care at other places with emergency departments, I'm sure that not everybody will be going to Korle-Bu. So functional emergency departments, well equipped. So we should have ventilators, we should have monitors, we should have ECG machines, we should have suction machines, we should have bedside diagnostic kits, ultrasounds, and then rapid diagnostic kits, and then emergency, medications. And if we are able to do this, start from somewhere, start planning towards all these things, I'm sure in the next few years we'll not be talking about, you know, such congestions that we are facing here.
Now, yeah, usually we have
there are so many. There's a lot of factors influencing this congestion, and we need to tackle them one after the other, and not to, you know, try to, you know, point it at, let's say, one aspect. Even emergency healthcare financing is part of the problem.
Now, that's a list of brilliant ideas that we have there. But usually the problem is, where do we start? How do we start? Who is responsible to start all of these brilliant ideas that we seem to have about dealing with the problem? If you get my frustration, and I'm sure that as a medical emergency physician yourself, you get frustrated. This is not the first time we're talking about this year. So all these ideas are on paper, and it sounds good. But how do we start? What would you recommend how would you recommend it is started? And the last time we spoke, we had the health service speak about this matter. They brought in this intervention. Now, this intervention doesn't seem to be working. what do we do? Did you think from the beginning that that intervention would work anyway? And what would you advise we do? I mean, the immediate steps. What can be done immediately to deal with the issue at Korle-Bu?
Well, so thank you, Gifty. The truth is that in crisis situations, well, you try to do the best, the greater good for the greater majority of the people. And that is the utilitarian principle, the greater good for the greater majority. If I'm seeing a patient, or I have, let's say, 10 patients, but I have only, let's say, 3 available beds, and then if I ask them, the 7 to go away, they are likely to die, then I'll do the best for them. But what tends to happen in Ghana is that we tend to perpetuate, the crisis situation. Something which is in a crisis, an emergency situation where we have, a lot of patients flooding in, and then we tend to, make it the norm that, well, patients should be seen on the floor, patients should be seen in coaches. No, I think that we are in a crisis as far as emergency healthcare is concerned, and you have asked what needs to happen now. We need to plan and we need to prioritize. Now, Korle-Bu hasn't got enough, emergency bed space to take care of the patients coming in. What needs to happen now is for the other facilities to start taking some of the load off Korle-Bu. We have Rich Hospital there, we have Police Hospital there, we have 37 Hospital there. They need to communicate among themselves. The truth is that whilst you are thinking that I'm overwhelmed, and you are thinking that another place is free, they may also be seeing significant number of patients. What needs to happen is for all hospitals to communicate among themselves now, and this has to be coordinated. Somebody has to coordinate the emergency beds in the Greater Accra region. And this is not even the Greater Accra region alone. We're talking about Ashanti region. We also have challenges with, bed space. There has to be a coordinated effort. Try to know the number of emergency beds available, whilst we systematically try to improve the number of emergency beds through creating new ones, functional emergency beds, creating new emergency departments, and making it function as such, with the necessary and requisite resources. Because you talked about the policy that was given. Anytime that somebody gives a policy, you have to ask yourself whether there's a provision for that policy. If there's no provision for the policy will be redundant. Because if you say that patients should be seen, they should not be rejected. Nobody wants to reject patients, but you should make provisions for the patients that you are saying they should be seen. Are you increasing the number of beds? Are you increasing the number of emergency doctors? Are you increasing the number of emergency nurses? Otherwise, with time, all these health workers will even break down. There will be a burnout. There will be stress, and then depression and all that. And they will also be, churning out skills duties, and they cannot be coming to work. Right. So we need to start coordinating, emergency care in the country. There should be a coordinator. We have a database for all the beds in every region, and then we should try and then categorize the hospitals based on their competencies, based on the availability of services which are there. So, for example, we know that there's a surgeon here, and therefore, if there's a need for, there's a surgical emergency, this patient can be seen at this, hospital. We need to categorize hospitals based on the services that are available, based on clinical services. So there's a neurosurgeon here, okay, let's take note. There's a gynecologist here, let's take note. We have a CT scan here, let's take note. We have an X-ray here, let's take note. So that if a patient who is critically ill or injured is being referred, we know that, well, this hospital has all these capabilities, and therefore the patient can be adequately and appropriately taken care of. Otherwise, until we're able to categorize that, well, every hospital is this hospital, they should be able to see this. No. It may well be that this hospital hasn't got a surgeon or hasn't got a gynecologist. So we need to start categorizing the hospitals, and then they should also be remunerated based on the outcomes. Always, we are looking just at the numbers. People respond to the money. If you are supposed to provide some kind of service and you are not providing it, and then the health insurance, also downgrades your payment, I'm sure that the next round they will try and make sure that those services are available.
So there are basically several factors.
So we need to categorize them. We need to track patients in the pre-hospital, and then we need to make sure that they are sent to the appropriate facilities, and they are not always sent to one place. That is the first thing that needs to happen.
Okay.
That we categorize health facilities,
this is
sure that the services are available, and make sure that we try the patients, and then systematically we try to improve emergency, rooms, and then equipment, ambulances, all the things, and then the personnel as well.
Dr. Ampofo, we'll say a very big thanks to you. This is what time will allow us for. So basically, other hospitals, his recommendations is that other hospitals, the police hospital, the Rage Hospital, etc., should help, or they could take in some of the patients overflowing from the Korle-Bu Teaching Hospital. Dr. Maxwell Ampofo is an emergency physician with the Comfort Noche Teaching Hospital. Social media, obviously, is awash with a lot of interest on this matter. Let's take some comments on there. Bunny Green says, I will keep on praying for Ghanaian leaders to keep on dying. God will keep killing them one after the other. This is not about NPP or NDC issues. It's a Ghanaian issue, and Ghanaian youth and it people should take action. I believe you are trying to say I've stopped getting angry over things like this, and you go on and on about God killing them. No court, don't less. Says the salaries parliamentarians are taking out too much. 1,000 cities should be taken off their salaries just for the beds and these petty things. Some of them don't even contribute in Parliament. Bernard McCarthy says $11 million can build different hospitals like that. But politicians, I believe you're trying to use the money to buy buses. Why in Ghana? Why in Ghana everything is poor? I believe that's the question. Let me finally end with you, Prosper Ayumea, who says this must trigger national emergency response, not fallout from NPP delegate conference. Let's for once value human life. Abba, I'm so devastated. What a country. What matters don't matter, and vice versa.